recording? Okay, there we go. Hi. Hi, I'm Maria Lee. I am a student nurse practitioner. What's your name?
Ryan.
Can I call you by Ryan? It's
Yes,
Ryan Lee,
fine.
right?
Yep.
Okay, nice to meet you. All right, and what brings you in today,
I'm
Ryan?
here for my annual physical.
Okay, great. Well, let's get started. I'm just gonna take a look at your head and face and take a look for any lesions, scars, lumps or bumps that we need to be worried about. Okay, I'm gonna check your scalp. Okay. Hair distribution is good. I don't see any hair loss. That's good. I'm going to take a look at your face here. Symmetry is good. General appearance is good. Color, physical constitution and build is healthy. We reviewed your vitals and your height and weight prior to starting, and everything looks within normal limits, so we're not worried about any of that. I'm going to feel your sinuses. Do you have any pain there?
Nope.
How about here?
Nope.
Nope. Okay, I'm going to feel your temporal arteries. And they feel even. I don't feel any thrills. I'm going to grab my stethoscope and take a listen. Listening with the bell. Okay. And I would say a 2+ is expected bilaterally. I don't hear any bruise. Can you shrug your shoulders for me? Okay, good. And I'm going to take a look at your eyes. Your sclera and conjunctiva look good. I don't see any hemorrhages or lesions on your lids or your outer eyes. I am feeling for your lacrimal gland and then the ducts. And I don't feel anything abnormal there. I'm going to do a couple of vision tests on you. The first one, I want you to tell me where I'm wiggling my fingers, okay? Good. Good. Great. And now follow my finger with your eyes. Okay, great. I'm going to take a quick look at your pupils. Okay, good. And we'll have to turn the lights down a little. I'm going to look for your red reflex in both eyes. I think we might be able to do it with that off. Let's see. Look it straight at me. There we go. Yep, I can see it. Okay. Good, both eyes. Now I'm gonna look back in each of your eye and inspect your optic disc. We're gonna look a little further back here. All right. Good. Clean, sharp borders, no hemorrhages, good color. Vessels look good. Do the other side. Okay. Same over here, no abnormalities. check your vision. We measured about 6 feet. There we go. Okay. Can you read this line with both eyes?
EPTZO.
Okay. And then cover your left eye. Can you read this line?
CFDHG.
Great. Cover your other eye. Can you read it backwards for me?
GHDFC.
Great. And you don't wear lenses or glasses. All right. Okay, everything looks great with your eyes. I'm going to go ahead and check out your ears. Do you have any hearing problems that you're aware of? No? Okay. See any lesions? Your ears look nice and symmetric. Does that hurt?
No.
No? Okay, good. All right, I'm going to do a quick hearing test. The first test is called the Weber test. I'm going to vibrate the tuning fork, and then I'm going to place it on your head, and you tell me if you hear it more on one side than the other.
Nope.
Equal?
It's the same.
Okay, good. All right, now I'm going to place the tuning fork behind each ear. You tell me when it stops vibrating, and then I'm going to bring it out, and you tell me if you can hear it.
Yep.
Okay, good.
Yep.
Okay. Great. Another one. Can you hear over here? About here. Good. I'm going to take a look inside your ear. Let me get my cover for this. Okay. Good. Canals look clear, no redness, no sores, no drainage. Tympanic membrane is a nice pearly white. I see the light reflex at about 7 o'clock. No edema or bulging, no erythema. I'm going to go over to the other side. Alrighty. Same. Canal's nice and clear. No irritation. And I see the light reflex at about 4 o'clock on this side. And that's what we expect to see. Everything looks good on this side too. Great. So, I'm just going to take a look at your nose here for a minute. Do you have any problems with your septum? Ever break it? Okay. See any drainage or sores? I'm going to put another cover on here and take a look in your nose. Actually, can you tilt your head back and cover one nostril for me and breathe a little? Okay, other side. Okay, good. You're nice and clear. I'm actually going to test your smell quick. Tell me if you can smell this. It's just a little alcohol pad. Good? Okay. All right, now we'll go ahead. I'm going to look a little further in there. Clear, no polyps, no drainage, moist, dark pink like it's supposed to be, no swelling. Same thing on this side, and polyps, and I do not see any defects of the septum. Sorry about that. Okie dokie. Now I'm going to put my gloves on and we're going to check out your mouth. First, I'm just going to take a look at the outside. I don't see any sores. Teeth look good. Say ah. Buccal mucosa is pink and moist. No visible sores. Teeth all are in good condition. It looks like you have all of your teeth. And tongue looks good. Can you lift your tongue up for me? Great. I don't see any lesions or patchiness. I'm just going to take a look at your gingiva again. Okay, good. Nice and pink, not irritated. Okay, can you say ah? Okay. So your uvula lays nice and midline, what we're looking for, and your tonsils are kind of tucked in there, which is normal for an adult, but that all looks okay, so I'm not worried about any of that. I'm just going to take a look at your neck, see where your trachea is, and that's nice and midline also. Can you swallow for me? Okay, good. Swallow again. Okay, good. I'm just looking for the border of your thyroid gland. I'm going to have you stand up and swallow one more time while I feel it for your thyroid. Swallow. Okay, good. All right, I am going to feel your carotid pulse now. Good. 2 plus on that side. I don't feel any thrills. I'm going to take my stethoscope and listen to it again with the bell. Okay, no bruise. No bruise, and it sounds equal on both sides. Since we're at the neck here, I'm going to go ahead and feel your lymph nodes. Pre and post auricular, posterior, anterior, posterior, and then supraclavicular. And I don't feel any abnormal lymph nodes there either. So that's good. Now I'm going to test your range of motion for your neck. Can you put your chin down to your chest? Good. And back. Can you put your chin to your right shoulder? Left shoulder? Either way. There you go. That was good. Okay. So let me just take a look at the back of your neck also. And I don't see any deformity. You have no pain in your neck? Okay. No problems with the cervical spine. All right, so I'm going to go ahead and take a listen to your lungs and check your thorax. So if you could take your shirt off, and we'll go ahead with the rest of the exam. Great. Okay, so I'm just going to watch you breathe for a minute. Relax. Look at your chest. Back. Okay, AP diameter is good. Breaths are depth and rate is regular. No accessory muscle use. No deformities of the chest or back. I'm going to just touch. Tell me if you have any pain. pain?
Nope.
Okay, good. Okay. Just gonna listen to your breath sounds. Good vesicular sounds. I don't hear any adventitious sounds like wheezing or crackles, which is what I'm listening for. Again. Before I listen anymore, I'm going to ask you to say 99.
99. 99. 99. 99. 99. 99. 99. 99.
Okay. And I'm going to do a little percussion. Consolidation or hyperresonance, which so far I have not found any indication of. Okay, I'm doing that. Okay. No signs of any problems there. I am going to have you turn a little bit so I can get to your back. At about the 10th rib, I'm just going to have you breathe in and out. Okay, and again. Good. Good expansion. And I'm going to feel with some of that percussion again for your diaphragm. And breathe. Breathe again. Good job. Okay. Now I'm going to do a couple more little tests to see about that consolidation, but again, you're doing great. I don't expect to hear anything abnormal at this point. Just go ahead and say E.
E. E. E. E. E.
On the back.
E, 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 E.
Okay, that sounds good. And now I'm going to have you whisper 99 while I do that. Great. So your lungs sound clear, and now I'm going to check out your heart. And while you're sitting up, I'm just going to look here at the light. I'm just going to watch for any pulsations. I don't see any. Chest looks good. Okay, I'm going to listen while you're sitting up. I'm going to use both sides. Do the diaphragm first. Okay, aortic, the second intercostal. Pulmonic, Herb's point. Tricuspid. This one I'm going to have you lean forward towards me. Good. Sit up. Mitral. I'm going to do the same thing with my bell. Sometimes we hear murmurs a little better with this. So far everything sounds good. Lean forward again. Good. Okay, good, strong S1, S2, regular rate and rhythm. I don't hear anything I'm concerned with so far. Could you lay down on the pillows for me? We're going to keep you at about a 30-degree angle. And I'm just going to take a peek at your jugular for distension, for jugular vein distension. Take a look to the left. Good job. All right. And so I can see a little bit of undulating. That's normal. That's what we want to see. I don't see any signs of distension. I cannot palpate, which is pretty normal. Okay, now I'm going to take a look. I'm going to look at your point of maximum impulse and see if I can see any pulsation or thrills, which I don't. I'm going to feel. Okay, and I don't feel any heaves or lifts, so that's good. And then I'm going to take a listen again while you're lying. Okay. Aortic. Pulmonic. Herb's point again. Tricuspid. Mitral. Everything sounds regular. I don't hear any murmurs. I don't hear an S3 or an S4. Okay, and for this last one, I'm going to have you turn on your side, on your left side, so I can listen to your mitral valve. And this is the best way to hear this if there is a murmur. Okay, and then I don't hear any abnormalities there, so we're all set. You can sit up and put your shirt back on.
All right.
Thank you.